Hello, everyone. This is Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight webinar where we talk about Lyme disease. You create the webinar with your questions. For those of you that are here, I see a number of familiar names on my message boards. Welcome back. And so you know how these work. For those of you that are new, the way that you participate is a few things. Number one, you can listen in on the answers. Number two, you can actually write questions to me. And the way you do that is over on the right-hand side of the screen, there's a chat box, and you can write your question to me through there. The only thing I ask is with your questions is try to keep them brief. If they get to be too long, I just can't post them here for a couple reasons. Number one, long questions seem to lock up my computer screen. And number two, they get hard to follow for people because there's a number of people that participate in these webinars through the recorded version. And although in the live version here tonight, you'll see the questions posted on your screen, and the recorded version, they do not, okay? So I will be reading all of those questions as well, too. I am creating a recording of tonight's webinar, and tomorrow morning, sometime, hopefully before about 9:30 in the morning, you'll get an email from me saying that I have edited it and it's ready for you to see. So keep your eye out for that. And in tomorrow morning's email as well, you'll be able to sign up for the next webinar, which is next week. Next week will be my last webinar for January. So tonight and tomorrow night are the two remaining webinars for January. So with no further ado, let's go ahead and get started here. I'm going to go ahead and take our first question. All right. So hello, Bill. Let's see. Hello, Dr. Ross. Have you linked Raynaud syndrome to a tick-borne infection? So Raynaud's, everyone, is a condition where you get spasming of your blood vessels in your fingers or your feet primarily, which can lead to them either turning white or blue and being painful, basically. What triggers that to happen is temperature fluctuation. It can either be, in some people, it's that they move into a warm room. For a lot of people, though, it's usually triggered by moving into a colder environment. Chronic infection of any kind, whether it's tick-borne illnesses or whether it is other chronic infections, can lead to this. So it's not unique to any one of the tick-borne infections like Lyme or Bartonella. It's not specific for any of those. The treatment ultimately is to try to get your germs under control. And number two, try to avoid a lot of temperature variations. And if you happen to be a person that's triggered in cold environments, wearing gloves, basically. The other thing that can sometimes help with this Raynaud's phenomenon to decrease the a spasm of your blood vessels, you can sometimes use a group of blood pressure medicines, which are called the calcium channel blockers, can sometimes make a difference for it. The other thing that can sometimes help is to be on the herbal medicine called ginkgo biloba as an 80 milligram pill twice a day. What ginkgo does is it makes it so that your red blood cells are a bit more flexible, so they can move through the really narrowed areas that happen in your red blood cells when they not your blood cells, in your blood vessels, should say, when they go into spasm, so that the blood can flow easier into those narrowed areas and still warm your tissues, basically. Okay. All right. So that if you were to do the ginkgo biloba, it would be 80 milligrams twice a day. I'd give it about a month trial to see if it is or is not going to work for you, though. Okay. All right. Thanks for the question, Bill. Hello, Mary Jane. Let's see. Hi, Dr. Ross. Do you ever prescribe gabapentin to help with pain and sleep? Yes, I do. So everyone, gabapentin is a medicine that was originally designed as an anti-seizure medicine, okay? And it binds to a receptor, a neurologic receptor in our brain called GABA receptors. And GABA receptors are also known as GABA benzodiazepine receptors. And those receptors are where Ambien, like the sleep medicine Ambien, will bind to those receptors. Gabapentin will bind there. Lyrica will bind there. Lunesta, I believe, binds at that receptor. So anything that binds at a GABA benzodiazepine receptor can make you sleepy. Okay, benzodiazepines would be things like would also be things like Xanax, for instance. Okay, so anything that binds there can make you sleepy. The other thing, if you bind to the GABA benzodiazepine receptor, it seems to decrease neurologic transmission of pain, so it can be a way of managing a pain as well. So yeah, I'll use it. You can use it as a 300 milligram pill. I sometimes will dose people up to 600, 900 milligrams at bedtime if needed. You can also use it in the daytime as well. And the thing that limits, basically the limiting amount of gabapentin is based on whether it sedates you too much or not. So for instance, some people in their pain control regimens may even take anywhere from 3,600 milligrams up to 7,200 milligrams a day. And if you're doing that, you need to divide it into 3 or 4 different doses. But the limiting factor is, does it make you too tired? Okay, that's what stops us from being able to use more of it. So yeah, I'll use it. I'll use it for sleep, and I will also wind up using it for pain control. Other medicines in that anti-seizure family that might do something that could be useful also would be Lyrica, which is kind of a refined version of the gabapentin, tends not to have as many side effects. And another medicine called Gabatril is in that same family of anti-seizure medicines that could have similar effects by binding to that same receptor. Okay, all right. Good luck to you. Thanks for that question, Mary Jane. Actually, let me just show you so you can see more information about this. Let me do a quick screen share here. All right. So this is my Treat Lyme website. Many of you are familiar with it. This is where you would have signed up also for the webinar tonight. Take a look at my section on pain. I believe I have something in here. Stop Lyme pain. Let's see. Cytokines, neurologic pain. Yeah. Yeah, so in here I talk about the Lyrica. I talk about Gabatril. I talk about gabapentin. Okay. The other place you could find information about those medicines would be in my section on sleep. And you could look at it underneath the prescription medicine section. And you'll find that I mention Lyrica, the gabapentin that I was just talking about. Those are things you could wind up using as well too. Okay, but if you're looking for other ideas, take a look here as well. All right. Okay, so yeah, thanks for that question, Mary Jane. Good luck to you. Hello, Teresa. Let's see. Is there a Lyme equivalent to COVID toes? I mean, the closest thing you might get to the COVID toes that you're describing would be the Raynaud's phenomenon that I asked about earlier tonight. Yeah. Let's see here. Hello, Catherine. Let's see. Dr. Ross, hope you can tell me what's causing a variable cornucopia of odd and painful deposits on and in my skin. Hold on just a minute. Oh, my computer is doing some strange things here. Bear with me for a minute, everyone. I'm going to come back to that question here in just a second. There. Okay, let me go back here. All right, my medical record system kept popping up into into our webinar tonight, and I was having a hard time following, and I also don't want to have you guys looking at my medical record system if I do a screen share. So anyhow, I had to get rid of that. Anyhow, let's try this again. Dr. Ross, hope you can tell me what's causing a variable cornucopia of odd and painful deposits on and in my skin. Some are translucent and cartilaginous, others sharp-edged and crystalline. They're in my mouth and nose and on my hands, forearms, shins, knees, forehead, and particularly painful on my knuckles, where they're so dense and deeply embedded my fingers click when I try to bend them. And spreading despite aggressive treatment. I tested positive for Lyme and Bartonella, but I've not seen PICCs that look like this. Thank you for all you do. I actually don't know. I haven't seen something like this before in terms of Lyme and co-infections. The only thing that I wonder, and I guess I'm not able to look at your lesions to see this, but sometimes when people have lipid disorders, meaning that you have high levels of triglyceride, fats, or cholesterol, those sometimes can result in skin deposits that may look like what you described here. But again, words and what they actually look like are two different things. So I'm not saying you have a high cholesterol or lipid or triglyceride issue, but from what you described, I would wonder, and it might be useful for you to make sure your doctors have looked at your triglyceride levels and have looked at your cholesterol levels to make sure you're not getting deposits of fats into your tissues, okay? That would be a non-Lyme related issue. It just could be coinciding with the Lyme. As for something like this occurring in Lyme, I'm not aware of it. I haven't seen something like this before in my practice, nor am I aware of other physicians describing that as well too, okay? Good luck to you, Catherine. Hello, Robert. Let's see. I do not have a spleen, Dr. Ross. Thanks for your help. Robert, age 70. 4 years ago, I tested positive for Lyme with a Western Blot test through medical diagnostics laboratories. No co-infections were indicated. I've been dealing with chronic neurolyme for about 12 years now. Please make any recommendations you may given my spleen situation, including whether I should get COVID vaccine. Is it good to take magnesium supplements with Lyme? If so, which form? Okay, so regarding the spleen, it's not going to change an approach I would use in terms of antibiotics or anything else I recommend in terms of managing you. So just on that question alone, yes, when your spleen is out, it may make it so that you have some greater immune system problems, but it doesn't change what I would use in terms of managing you, okay? Number two, regarding the COVID vaccine, I haven't seen any information saying not having a spleen changes whether you should or should not have the COVID vaccine. As I look at the safety information on the COVID vaccine, I would see no problems with you getting the COVID vaccine. But again, this is something you should talk over with your healthcare providers as well too. But just on the issue of spleen out, I don't see it as a contraindication, and nor have the recommendations that have come out about the COVID vaccine list that as a reason not to get the COVID vaccine. Okay. Let's see. Is it good to take magnesium supplements with Lyme? Yeah, I have no problem people taking magnesium supplements with Lyme. I know that there are periodic reports you'll see that don't have magnesium. It feeds the Lyme germ. And so, yeah, I mean, I'm sure there are studies out there, and there are studies that show that Lyme does better with magnesium. Lyme does better with manganese. Lyme does better with a lot of things. But Lyme lives in us. So, of course, it's going to thrive on the same stuff we need to thrive as well, too. So I don't worry about limiting magnesium in my Lyme patients. In fact, it can help with pain. It can help with sleep. So generally what I like to use is either magnesium citrate or magnesium malate, or a mixture of both of those salts called a product called magnesium citramate, C-I-T-R-M-A-T-E by Thorne. Mixes both of those salts together. The malate can be especially helpful for muscle pains, and just magnesium is generally good either as a citrate or a malate, and mitochondria function, which are your cell energy factories, getting you sleep, muscles relaxing, etc. So that's what I usually like to do with that. All right. Oh, in terms of dosing ranges, I usually like to have people somewhere around 400, 600 milligrams a day, usually taken before bedtime, because it can aid in your sleep as well, too. All right. Thanks, Robert. Good luck to you. Hello, Teresa. Let's see. Thank you for this wonderful opportunity. Teresa, I know, let's see, it looks like, I think there's multiple parts to your question here. Let me see if I can put this together. So I see that you have IGenex lab C6 peptide was positive. And then I've got something that says in 2 months of ceftriaxone. Teresa, it doesn't look like your full questions are coming through. What I'd prefer you do is write them as one continuous question, because breaking them into small parts like this doesn't work. So don't send me your question in paragraphs, but rather write it as a continuous one and then hit the enter key to send it to me. When you hit the enter key, it actually sends parts of your question to me unless your whole thing is done. All right. So I'm not going to be able to answer this. I can't find the rest of the parts of it. Hello, Geraldine. What do you think of using L-lysine or cystis for Lyme? So cystis, I don't have an opinion on it. I know that I believe Klinghardt or Buhner may be recommending it here recently. I don't have an opinion on it. In terms of L-lysine isn't something I would use for Lyme. I do like using it, though, as a preventive to help with if you happen to have herpes. It is something that can help limit herpes simplex virus, which would be oral herpes or genital herpes. It can stop you from having regular outbreaks of that. It is something you have to take at 2,000 to 3,000 milligrams a day as a preventive. In terms of whether it does something for the Lyme germ, I have not seen any data that supports that at all. All right. Thanks, Geraldine. Good luck to your question. Or good luck with your illness. Thank you. Oh, I see Teresa, I see the rest of your question here. You're asking, is a C6 peptide a valid test? So C6 is a protein that is also found on Lyme, and we're trying to see if you make antibodies against it, but it falls in the category of what we call ELISA testing, which has, even if it comes back positive, it may be positive for other reasons. So I consider it more of a screening test rather than a test that proves the illness is in you. If a C6 peptide comes back positive, I'm going to want to confirm that the test is accurate by actually getting either a Western blot or which you can get through IGenex, or I would get an immunoblot, which is found at IGenex as well too. All right. Thanks for that question. So the issue is if it comes back positive, it could be a false positive. You want to verify that it actually means that you have Lyme by getting a test that is a better test for Lyme, which would be either the Western blot or an immunoblot. All right. Thanks for the question. Hello, Lapman. Let's see, Dr. Ross. Thank you for taking my question. How long would you recommend to stay on Rocephin antibiotic for Lyme disease? So Rocephin, everyone, is also known as ceftriaxone. It is an IV antibiotic. In terms of treating Lyme, I don't tend to use a lot of IV antibiotics in my practice. And in fact, I think the trend among doctors that treat chronic Lyme these days is away from using IV antibiotics, because generally working with oral antibiotics, we can do as well as IV antibiotics, and we don't carry all the risk of IV antibiotics. So the risk of IV antibiotics is you've got to have an IV line put in, usually called a central line or a PICC line, and that IV line can have chances of getting infected, causing more bacteria infection to get into your bloodstream. And also those IV lines can sometimes develop blood clots at the tip, and those blood clots can break off, float into your lung, and actually kill part of your lung. The chances of getting complications from a PICC line and the IV line that we have to use for IV Rocephin, if we use it chronically, is about 15 to 20% of people over a 6-month period of time that have PICC lines in are going to have them removed, either because they got infected or because people develop blood clots at the tip. Okay, and so I think, so when I look at IV antibiotics and helping Lyme, the only two situations these days where I might go to them more early in a treatment is if I've got somebody that has a heart block, meaning their heart conduction system is failing them, or if I've got somebody with rapidly deteriorating cognitive or mental health or central nervous system neurologic problems. Okay, now everybody with Lyme has some degree of central nervous system and thinking problems. So what I said was rapidly deteriorating problems. Okay, so I want to be clear about that. If we look at oral antibiotics that treat Lyme, they have about an 85 to 90% chance of helping a person, versus IV antibiotics tend to have about a 90 to 95% chance of helping a person, meaning about a 5% improved chance of helping versus oral antibiotics, but they carry a lot of risk with them as well too. All right. So how long can you use them? I mean, as long as I use them, if I'm going to use them, I'm going to use them until I start seeing good improvements, and then I'm going to switch somebody over. That sometimes can be about a month, maybe 2 months. I have done up to 6 months of IV Rocephin in a patient before, but I'm usually trying to get switched over to oral antibiotics as soon as we've got good improvements going. Okay. And again, I just don't use much in the way of IV antibiotics anymore in my practice. And I think the majority of doctors, a lot of us used to do a lot of IV antibiotics, but it's just over time, the trend is away from doing that, more to doing the oral antibiotic combinations at this point. All right. Thanks for that question. Hello, Gail. Let's see. Hi, Dr. Ross. I have 2 questions. The first one you might think is a bit insane. It's Lyme disease. Nothing is insane in this disorder, Gail, so I appreciate that the warning of me about that. Let's see. I'm very hesitant to get vaccinated due to Lyme, co-infections, and a positive ANA. My husband and son who live with me will get vaccinated. Is there any way medically that when they get the vaccine and their bodies are having an immune response, especially if they have symptoms such as fever, headaches, etc., that they could be contagious and spread COVID to me? Should I avoid them for a few weeks after they get the vaccine? Also, if it's unknown if one can still contact COVID and transmit it asymptomatically once vaccinated, doesn't that put me at great risk living with 2 vaccinated if I am unvaccinated? All right, let me try to break. I'm going to go through part of this. So first of all, your risk of getting COVID from them getting vaccinated and the vaccine giving them COVID is 0, because the vaccine is not a live virus. The current vaccine actually from both Moderna and Pfizer is genetic code that that they get that then tells their cells to start manufacturing a protein found on the COVID virus called the spike protein. And once they start producing the spike protein, that triggers an immune reaction against the spike protein. Okay, so it's not a live virus. You're not going to get COVID from them. The other vaccines that are out there, the AstraZeneca in Europe that's being approved is basically is a virus vaccine, but it's not the I believe it's a virus. Actually, I need to look a little bit more, but it's not a live virus either, and it's not the COVID virus either. Okay, so anyhow, you're safe. You're not going to get COVID from them getting vaccinated and then giving it to you from the vaccine. All right, now in terms of can people transmit COVID if they've had the vaccine, the answer is yes, they might be able to, but some of the data is telling us that probably a person's ability to transmit COVID if they get COVID and they've been vaccinated is actually small. We think that probably, even though that it's not official yet, there probably is some protection from being able to transmit COVID if you get the COVID vaccine, although it's not universal, okay? Gail, it's an imperfect world. The chances of them being able to give something to you by being vaccinated is probably a lot less than them getting the COVID and bringing it home and giving it to you if they were not vaccinated. And so I would err on the side of them getting vaccinated. Okay. And so anyhow, that's how I would probably address that. Let's see, what's your feeling about contraction and transmission of COVID in those who have been vaccinated? Do you think they will be able to determine at some point if this is able to happen? I've never heard of a vaccine allowing this to happen. Will that go away once there is herd immunity? Those are all good questions. The answer is I don't know. I think that, at this point, what we know from these two vaccines is that there may still be some ability to transmit, but eventually you knock out enough people getting it, and eventually we probably decrease through herd immunity. There's just not enough of the virus left out there to cause a problem. Again, I think that although they're not officially saying that the vaccines can stop transmissibility, there probably is a degree by which they will stop transmissibility. At least some of the preliminary data from the Moderna and Pfizer vaccines would suggest that. Okay, all right. Thanks, Gail. Good questions. I wish I had perfect answers for you, but I don't. All right. Hello, Paula. Let's see, is there a new treatment for Lyme that really works yet? $1 million question. I mean, the treatment for Lyme that seems to have is helping a lot of people is to do the disulfiram treatment that you may be familiar with, which is a drug that has traditionally been used to treat alcoholism, but seems to be able to get about 40% of people into remission. Beyond that, I don't have any new ideas for you. I'm going to show you where you can look up the information about the disulfiram, but no, there isn't any new wonder treatment. The other idea out there is the same lab that researched and came up with the idea of using disulfiram to treat persister Lyme. Dr. Rojadas in his lab also found that another antibiotic called Azlocillin is able to treat persister forms of Lyme as well as growing forms of Lyme, and that idea got everyone all excited. The trouble is with that antibiotic, it's not manufactured anywhere. Although it's a drug that has been approved by the FDA, it's not been manufactured by anyone, so we can't get our hands on it. The animal studies, looking at mouse studies, it looks like it does a good job of killing Lyme, both growing forms and persister forms of Lyme, but I have no idea, will it work well in a human? Those human experiments haven't been done. But that might be the next big treatment over the horizon if somebody can start manufacturing it. Beyond that, I don't have any new wonder drugs for this illness, unfortunately. Let me show you the article about the disulfiram. All right, so again, disulfiram is I think most people are familiar with the idea of disulfiram, but here's my article on it. Talks about the potential or the benefits of it, potential side effects, etc. Okay, you'll find it here in this article, and you can just put in disulfiram up here in the search bar and you'll find it. Good luck to you, Paula. Hello, Teresa. Let's see. Is 2 months of ceftriaxone and clarithromycin standard, both taken twice daily? It all depends on what you're trying to treat. I mean, sometimes we'll use them shorter, sometimes we'll use them longer. I would need to know more about your specific condition, more details of your specific situation to be able to comment on that. Okay. Thanks for the question. Hello, Santiago. Let's see. Hi, Dr. Ross. Is a Lyme immunoblot IgG IGenex criterion equal positive, but CDC criterion equal negative, and both IgM criterion negative? Do you consider it a positive for active Lyme? All right. So when we test for Lyme, we're looking to see, do you have antibodies from two families? There's a family called IgM and a family called IgG. When you first get infected with something, it's IgMs that you develop. And so when you get a positive IgM, it definitely means there's an active infection there in an acute situation. Okay. Now, IgMs generally get replaced by IgG antibodies about 6 weeks to 3 months into an infection. And then once you make IgGs, you keep making them even if the germ is gone. So when you get an IgG result back positive, the best it tells me is that you had an infection in you, but I cannot tell by looking at it whether it is still in you, because it's the memory of the immune system. Okay, so your immune system may remember, okay? The only way we can really tell at this point whether you have active infection is to look at your symptoms. And if you got a lot of symptoms of Lyme and you've got a positive IgG, that probably means it is an active infection, but we don't have a way of proving that it's still active in you or not. All right. Now, IgM antibodies in Lyme, remember I just said that in infections, they're supposed to go away by 6 weeks to 3 months into the infection. Lyme is a quirky illness that for some reason, about 40 to 50% of the time that somebody has Lyme that is out of the acute period, it could be years down the road, about 40 to 50% of people keep making IgM antibodies, even though they're not supposed to. And we don't have a proof for why it happens. There are many theories about why it happens, but it does happen. And so a lot of times the infectious disease doctors who don't believe in chronic Lyme will look at IgM positive testing and call it a false positive. If you've been sick for a number of years, they just automatically call it a false positive because they can't understand why it happens. Well, just because you can't understand why it happens does not mean it's false. It means that for some reason it's not changing over to the IgGs, but it does indicate you had an infection. And again, if you have a lot of symptoms that still suggest Lyme, then it probably means you have Lyme. Okay? All right. Thanks for that question, Santiago. Hello, Laura. Hello, Dr. Ross. I have difficulty swallowing, elevated heart rate, dry eyes and throat, white tongue, disturbed sleep, body numbness, including the heels, tinnitus, moodiness, fear, tiredness, pressure and ache on the chest, intermittent pain, burning and pressing on the back of the head. My Western blot is positive, but could this actually be Bartonella? Thank you. Let me look at this again here. So I have difficulty swallowing, elevated heart rate, dry eyes and throat, white tongue, disturbed sleep, body numbness, moodiness, fear, tiredness, pressure and ache on the chest, intermittent pain. So the answer is it could be. It could be Bartonella. Key Bartonella symptoms that I like to look at, number one, sometimes people with Bartonella will have a lot of pain on the soles of the feet. Bartonella also can give a lot of neurologic problems. So the swallowing difficulty may be a neurologic problem. You obviously have, let's see, you've got some body numbness in the heels, and you've got the ringing in the ears. So that could be from Bartonella, that could be from Lyme. Bartonella can give a lot of psychiatric kind of issues. So the moodiness that you're having could be from Bartonella. Anyhow, but Lyme can do that too. So this is a kind of situation where I've got symptoms like this that I might tend to treat you covering for both possibilities. Now, in terms of Bartonella, more and more, I'm starting to shift over to doing a test that was developed by IGenex that came out probably about a year or so ago now, called the Bartonella Western Blot test. Their way of checking, so what that test does, that IGenex does, the Bartonella Western Blot through IGenex, looks to see if you have antibodies that are made against 4 specific types of Bartonella and the family that those 4 specific types are in. Okay, now we recognize with Bartonella, we think that there are 15 strains that can infect humans. Standard labs like LabCorp and Quest can look to see if you have antibodies against 2 of those. So those would be Bartonella cantana and Bartonella henseli. IGenex can identify 4 specific strains, but they also look to see, do you have antibodies against the whole family of Bartonella, meaning any one of the 15 that can infect a human. Based on their validation studies at IGenex, it looks like this test can pick up about 90% of Bartonella. And so it's tending to be my preferred way of testing for it. Now, I have to admit, if it comes back negative and you still got a lot of symptoms of Bartonella, or could be Bartonella, I'm still going to treat for it. But it is a test more and more that I'm starting to use to prove if somebody does have Bartonella. Okay? All right. Thanks for the question. Hello, Patty. Hello, Dr. Ross. Thank you for the opportunity to pick your brain. You're welcome. I'm currently treating mold with Welchol and N-acetylcysteine for about 6 months. IGenex results show positive for Bartonella fish and Western blot IgM for Bartonella elizabethae and Bartonella vinsoni. So everyone, the Bartonella elizabethae and vinsoni is 2 of the 4 strains that can be specifically identified by the IGenex Western blot. That's what I was just talking about. But again, there are 11 they don't specifically identify, but they can find if you have antibodies against the family. Okay. Let's see. What is the difference between these 2 tests, and would you expect these can be treated with herbals only? My symptoms are brain fog, memory retaining new info, mild depression, eye floaters, blurring, and sleep. Is treatment likely to provoke additional symptoms? My doctor says treating the mold will resolve the infection. I have heard this about Lyme. Is it true with Bart also? Thanks again. All right. So these tests, the Bartonella fish and the Western blot for Bartonella are 2 different tests, okay? The Western blot that you had done is looking to see, is your immune system creating antibodies that attach to the germ, okay? The fish test is looking to see, under a microscope, can you actually see the Bartonella germs, all right? So the Western blot is measuring an immune reaction, and the fish is saying, yeah, we can see them. Now, what FISH stands for is fluorescent in situ hybridization. That's a mouthful. What those words mean is they take a fluorescing agent as part of doing the test, and they attach it to the genetic material of the germ so that you can actually see it better under the microscope, because it fluoresces, it lights up, okay? If you get a positive Bartonella fish test back, it proves you got Bartonella in you. The difficulty is you got to have a lot of it in you for the Bartonella fish to be positive. So having a negative fish test does not prove you don't have it. But if you do get a positive Bartonella fish, it does mean you do have it for sure. And in addition, you got the immune reaction against it as well too, okay? Now, of your symptoms, yeah, Bartonella could be part of your brain fog. It could be part of your depression, might even be part of the your eye blurring. So yeah, you got some symptoms here that make me wonder that you have Bartonella as well too, okay? Now, will treating Bartonella with antibiotics make you get a little bit worse at first? It could, it sometimes does. It does not tend to have the same ability to do that as what treating the Lyme germ does though, okay? In terms of your doctor thinking that if you get mold taken care of first, that you won't need to, that it will resolve the infection. Let me try to clarify what I would mean by that, okay? So when you have Lyme or you have Bartonella in you, the main reason you feel poorly is that both of those infections trigger your white blood cells that fight infection to manufacture a group of chemicals called cytokines. And cytokines are good and bad. On the good side, cytokines turn on the immune system to deal with an infection. They draw the white blood cells to where the infection is and they help them work better. So that's all great, okay? All right. But if the immune system has a hard time getting rid of these germs, it's going to overproduce cytokines. And if you get excessive cytokines, they make it so you can't think. They give you fatigue. They can cause neurologic dysfunction. They can create psychiatric problems, all right? So when we say somebody has Lyme or tick-borne infection symptoms, what they really have are excess cytokine symptoms. Right? Now, in terms of the mold, if you get mold toxins trapped in you, they also trigger the white blood cells to produce cytokines. All right. So the symptoms of mold toxicity are identical, can look the same as the symptoms of Lyme and co-infections, because the end result is they all cause the immune system to make too many cytokines, and this is cytokines that give you your symptoms, okay? Now, I have seen in my practice that if I take a history from somebody and they come in and they think they have Lyme and they've got positive testing that shows it, but I talk to them and I find out that they got sick in their life when they lived in the house that had black mold on the walls, I might start thinking, I wonder if their bigger problem is actually mold toxicity and maybe it isn't even Lyme. Let me rephrase that. Maybe their Lyme is actually gotten under control by the immune system, okay? So there are some situations where it's clear to me that somebody got sick with their mold exposure. I will try to remove the mold toxins first. And there are times that that's all I needed to do. Now, what I think happens in those situations is that the person probably had Lyme infection at some time, but their immune system was able to deal with it, okay? Now, in your situation, you have positive Bartonella FISH test, which means that the germ is in you and active and that your immune system did not deal with it. And in these situations, I am skeptical that just removing mold toxins is going to be enough for your immune system to turn on and fight the infection. On the other hand, if you had a negative FISH and you just had the Western blot positive, I might say, I wonder if your immune system dealt with it. Let's get the mold out of you first, because if you were in a building that had a lot of black mold when you first got sick, okay? So there is the possibility that when you test positive, if it's an immune reaction that you're positive to for the Lyme, it doesn't mean, or even Bartonella, it doesn't mean those germs are active. It just means you're having an immune reaction. And so there are situations where we may not need to treat them because maybe the immune system dealt with those. And the main problem is that you've got a mold toxin issue. In your situation, though, you've got truly living germ and you've got a positive Bartonella FISH. I'm skeptical that just removing your mold toxins will be enough to allow your immune system to put the Bartonella under control. Okay. All right. Thanks for the question, Patty. Good luck to you. Hello, Adam. Hello, Dr. Ross. I have daily cyclical symptoms, including headache, dullness, eye pain, visible floaters, and ear ringing every single day between 11 a.m. and 3 p.m. Can these all be due to tick-borne infection? Let me just read this again here. It's possible, Adam, but I would need, there's a lot more questions I would need to ask you to help figure that out. And it's not a typical pattern, so I would want to make sure you have some positive testing that supports having a tick-borne infection as well, too, okay? If you would like a little bit more specific help in dealing with this, because I would need to ask you a lot of questions, you may want to take a look at doing one of my online consults where I could visit with you and give you some information. I could ask those questions I need to be more specific in my response, okay? So let me just do a quick screen share here with you. Let's see. I'm going to show you how you can do that. All right, so at my Lyme disease information site, if you were to click on the clinic link up here, this is my medical practice website. Look at my appointments page and take a look at the description I have for what I call full medical service or a limited consult service. Okay, these are two ways I can visit with you online. Read about them in detail, like read every line here so you get all of the information about the differences between these visits and what I can and cannot do. And these descriptions include cost information as well too, okay? So read through this, but if one of these is something you might want to do, then go ahead and click the book now button and be glad to answer questions for you, okay? Good luck to you, Adam. Hello, Patsy. Happy New Year, Dr. Ross. Thank you. You too. Do patients with Lyme suffer from an exacerbation of symptoms if they have conscious sedation as they do when they have general anesthetic? Good question. The answer is I do not see that happen. So what Patsy is talking about is one of the things that we see is when people get general sedation, by general sedation, or general anesthesia, I should say. General anesthesia, what I mean by that is they put a breathing tube down your throat, a breathing machine breathes through you during the surgery, and through that breathing tube, they give you anesthetic gas. That is general anesthesia, okay? Versus there's a type of anesthesia nowadays that has a name called conscious sedation, which is kind of an odd name because you're not really conscious, you're still sedated. But they give, and what they do with that is they give you medicines through your veins to make you sleepy and stay asleep during the procedure you're having done. But it is different than having the anesthetic gas, okay? Now, general anesthesia, not conscious sedation, but general anesthesia, it is very common that we'll see that people with active Lyme will tend to get worse during general anesthesia, although usually it's about a month or two, maybe setback, and they will recover from it, okay? Versus conscious sedation, which is the IV form of sedation, I tend not to see any declines. I tend to see that people will handle those just fine. I tend not to see the decline in Lyme symptoms or Lyme disease when people have the IV or conscious sedation, okay? All right, good luck to you, Patsy. Thanks for the question. Let's see. Hello, Karen. Hello, Dr. Ross. Thank you for being so very knowledgeable with regards to all things Lyme. You're welcome. Let's see. I have had Lyme for approximately 4 years. Finally found out 3 months ago that I have Lyme, and it has crippled my knees and feet, so I can no longer walk at all. Let's see. I am optimistic that my Lyme protocol will cure this and allow me to walk again. Let's see, Karen, I'm trying to see if there's a question that goes with this. Oh, I think here's your question. Let's see, can I heal from Lyme arthritis? Thanks, Karen. Yes, you can. So arthritis means inflammation of the joint, okay? And so there's a couple things that can happen with that. One is acute inflammation, And then also sometimes, though, unfortunately, Lyme can cause injury to the cartilage in the joint, which can set up a situation of chronic inflammation, okay? So the inflammation caused by infection in the joint can recover as you get the germ under control. But again, one of the things that happens with Lyme likes to live in places that don't have a lot of oxygen, okay? So the oxygen in your blood can kill Lyme. And so it quickly tries to move into places that don't have a lot of oxygen, including your joints. In the joints, Lyme likes to try to burrow its way into your cartilage. Okay, now your joint basically is two bones come together in a joint, okay? And the surfaces of those bones are covered by cartilage. The job of cartilage is to basically act as a shock absorber so your bones don't beat up each other. But also that cartilage is smooth and glossy and allows things to slide over it. Okay, now cartilage is softer than the bone it covers and protects. And if it breaks down by Lyme germs burrowing into it, you can wind up getting bone rubbing on bone, and that sets up inflammation in the bone, okay? So for that kind of a situation, sometimes if you've treated Lyme and with antibiotics or herbal antibiotics and you're still having ongoing inflammation, in those joints, sometimes we have to repair the cartilage. And I do find that helpful about 80% of the time. If I've treated somebody, for like a year or sometimes more with herbal or prescription antibiotics and their joint pains are just not getting any better, I'm going to wind up trying to do some things to repair the cartilage. And it helps about 80% of the time. What I'd like to use to repair the cartilage is to do something called glucosamine sulfate. Glucosamine is one of the building blocks of cartilage, and if we give you more of the cartilage building blocks, you'll make more cartilage, okay? And so that'll work about 85% of the time. You have to give it at least a 6-month trial, so it's not going to give you immediate benefits, okay? And if you are going to do that, I strongly recommend you use good quality supplements. Keep in mind that a lot of that stuff out there is garbage. You want to make sure you're using brands that are pretty much are what I call physician grade. These are companies that have done a good job of sourcing their material so it's the most active ingredients, and they don't use a lot of artificial fillers that are wrong, okay? And the reason I'm pointing this out there, the garbage is out there. I mean, New York Attorney General did studies a number of years ago looking at supplements sold at Target, and I believe GNC, I think, was part of that study. And I think around 30% or so had ingredients in their supplements that weren't supposed to be there. And about 30% or so didn't have all the ingredients they said was in those supplements based on what was in the label. Okay. And the way that they did determination, they did genetic studies to find this out. Okay. So, got to be careful out there. Okay. So what glucosamine sulfate would I use? And you may even wonder, well, given what I just said about supplements, what can you trust? Let me do a quick screen share for you here. Okay, so if you're looking to see what do I recommend, what have I found, what products and brands do I think are good and provide quality products and that actually provide the ingredients in the product which they say is on the label, take a look at my supplement store. So this is Marty Ross MD supplements. The URL is treatlyme.com. And so anyone can buy here. So this is a store I use for my existing patients, but anybody can use the store, okay? And so I welcome your business, basically. But take a look at, if you want to know what do I recommend, what brands do I recommend, these are the brands I recommend. If you want to know what glucosamine sulfate would I use, take a look at, just write the word glucosamine in here, glucosamine. And the product, these are a number of products that have glucosamine in them, but the one that is a source where it's just glucosamine by itself is this Thorne product. So I like Thorne products. And again, this is the product I would recommend. But yeah, if you're going to try it, make sure you're using good quality, okay? All right. One last thing in terms of inflammation in the joints. So in terms of managing the arthritis while you're trying to kill the germs, one thing you can use is to lower the inflammation in the joints is to use curcumin. Curcumin is a component of the Indian seasoning turmeric, and it gets inside of your white blood cells and turns down their cytokine production. Remember I was mentioning cytokines earlier tonight? Cytokines are the inflammatory chemical in Lyme. And so what you can use to manage that inflammation is curcumin. The product I like for that is also made by Thorne, and the product is called Mariva 500, and you would want to do 1 pill 3 times a day. That is what I would use to help manage the inflammation while you're being treated. But again, if you get like 9 months to a year into treatment and your joint pains aren't getting better, think about rebuilding the cartilage with the glucosamine that I was talking about. Okay? All right. Thanks for that question. Good luck to you. Here. All right. Hello, Sue. Let's see. What is your opinion on laser treatment for Lyme? Have you heard of the laser Lyme treatment centers? I have not seen good results. I'll put it that way. I'm skeptical of it. All right. All right. Good luck to you, Sue. Hello, Patty. Hello, Dr. Ross. Thank you for the opportunity to pick your brain. Oops, I think I already answered that one earlier. I think you wrote it to me twice. Hello, Laura. Let's see. What is your opinion on using radiofrequency denervation to temporarily kill the nerves in the middle and lower back where a person with chronic Lyme-Bartonella and BAB has severe constant pain? She is worried about the risk of infection from the needle that goes into the back. The pain clinic chose not to first try a nerve block on her back to reduce pain because it involves steroids, which would further suppress her immune system. On your website, it probably says, how do you reduce ammonia as a result of taking, let's see. On your website, it probably says how to reduce ammonia as a result of taking Disulfiram for Lyme. I would imagine you do. Thank you very much. So first of all, no, I don't address ammonia from taking Disulfiram. I don't have something on my website, and I would be interested to know what you're talking about because I haven't seen any problems with ammonia, actually. That doesn't mean people don't get ammonia, but I don't think it's due to the Disulfiram. I'll put it that way. Secondly, in terms of, so it sounds like they're concerned that the pain is coming from nerves in the back. And so although they can't, so sometimes what we'll do, we want to see if that really is what the issue is we can try to do numbing medicine injection around those nerves. And sometimes we'll include steroids with it. Now, because they don't want to do steroids because she has Lyme, I understand that. They could still inject the numbing medicine around it and see if it gives her some relief. So I'm not sure why they're not doing that, okay? In terms of the radiofrequency denervation, you could try that, but I think I'd probably see if they would just inject like a lidocaine or medicines in that family around the nerve to see if it's going to work. They do not need to include the steroid in it to see if it is something that's going to be useful. Okay. All right. Thanks for that question. Hello, Latman. Let's see. Hi, Dr. Ross. Does chronic babesia is curable? If so, how long would it take with medicine? So, yeah, a chronic babesia can be curable. And in fact, I think that we are able to get about 85% of people cured of it, okay? Now, in some people, it can be difficult to get the cure, but we can get there. On average, to get rid of babesia, it takes about 4 to 5 months. And usually if you're on a treatment that is working, by around 1 to 2 months into the treatment, you should start seeing reduction in the babesia symptoms. Okay, what are babesia symptoms? Well, babesia symptoms, and I'll show you an article, you can look at this for more detail later, but babesia symptoms are air hunger, feeling like you can't get air even when you're at rest, drenching night sweats, sometimes having some instability of the adrenaline system in the body. So you'll get racing of the heart periodically that suddenly drops really low. People with blood pressure instability sometimes can be part of that too. Babesia also can give migraine type headaches sometimes. And babesia sometimes can give you these little red blood spots under the skin as well too, okay? So those are things that I would follow. Oh, one of the other strange babesia symptoms, sometimes people with babesia get frequent deja vu experiences, which is always interesting because when you're treating them, that is one of the first symptoms that starts to respond is the deja vu starts going away. It's a very interesting symptom, I think, okay? So if you want to read about what are babesia symptoms in more detail, let me just do a quick screen share here. All right, so in terms of, so back here at Treat Lyme by Marty Ross MD, you ever want to know how do you diagnose anything, take a look at how to diagnose the section here. And then in terms of symptoms that can suggest babesia, take a look at here. And you want to go ahead and scroll on down and I say rely on the symptoms. And I give you a lot of what those symptoms are right here, okay? Oh, I forgot about panic attacks a minute ago, and frontal headaches sometimes can be one of the babesia symptoms too, okay? Thanks for our question, Lapman. Good luck. Hello, Robert. Let's see. Oh, looks like you posted that one twice. I already got it earlier. And here's another one that was asked earlier. Here we go. Hi, Melissa. Let's see. If you have been treated for Lyme disease with the last 5 years and I'm still getting joint swelling in my finger joints, does this mean I have active infection? So just that one symptom, swelling in your joints, does not necessarily mean you have active infection. I would want to see if you have other symptoms that suggest Lyme is still present, like ongoing fatigue, body aches, muscle aches, maybe some difficulty sleeping, maybe problems with mental health, maybe problems with poor cognition, etc. I would want to see more than just the joint pain, okay? Because as I mentioned earlier, one of the things that can happen if you've had Lyme and has been treated is sometimes the Lyme germ injures your cartilage, and then that allows your bones to scrape on each other, which then leads to ongoing swelling and inflammation in the joint as well too, okay? And I talked earlier about how do you fix that with the glucosamine sulfate, okay? All right, good luck, Melissa. Hello, Lorraine. Let's see. Hello, Dr. Ross. Can you tell me what experience you have had with clients who are doing intermittent fasting, and can you elaborate on the methods and if they offer any success in healing a leaky gut? So intermittent fasting, I have not found as a way to help with leaky gut. I'll say that, okay? I'm not saying it won't help you because I don't believe there's any one diet that works in everyone, okay? But I have not found intermittent fasting to be something that would help with that, all right? All right. Thanks for that question, Lorraine. Hello, Erica. Let's see. If I have Lyme and a positive ANA, should I get the COVID vaccine? I was told to avoid the messenger RNA vaccines and wait for the other type of vaccines, such as AstraZeneca or Johnson & Johnson. Is that true? I don't agree. So first of all, regarding the COVID vaccine, what we're weighing is risk and benefits, okay? So the risk of getting COVID versus the risk of harm from getting the COVID vaccine, all right? All right, so the risk of getting COVID and dying or getting permanently injured from it is quite high, especially in the United States, where our president did not do a great job of helping us to control this thing, and people seeming not to want to wear masks to help protect their neighbors. We think we have a right to spread our germs for some reason. I know that's my commentary. Some of you may find that harsh, but mask wearing is how we protect ourselves, and also we protect our neighbors. So anyhow, so first of all, I think you have a high risk in the United States right now of getting harmed by getting COVID and potentially dying, or potentially having ongoing chronic symptoms from it, okay? So that's the risk of getting COVID. Now you have to look at what are the risks of getting the vaccine. In terms of studies that have been done on any of the vaccines at this point, no one has done studies specific to a person living with Lyme, okay? All right. But if we look at the safety that has come out of these vaccines, they're pretty safe, actually. The only group of there's a few situations that I think people need to be careful with. Number one, if you are a person that has a history of having severe reactions to vaccines and find your Lyme gets really bad for 2 months, maybe 3 months or more, you may want to reconsider getting this vaccine. Okay, you may want to. It's not an absolute not to get it, but you may want to reconsider it. Okay. Number two, if a person has an autoimmune illness indicated by either you've been diagnosed by a rheumatologist or somebody is saying that you have rheumatoid or lupus or one of those, or you have blood tests indicating autoimmune illness like an anti-nuclear antibody being elevated, you should be aware that you have a slight increased chance of getting another autoimmune illness if you get vaccines of any kind, whether it's COVID or not, okay? So for instance, the relative risk of picking up another autoimmune illness with most vaccines that are out on the market, whether these are flu vaccines, DTP vaccines, et cetera, seems to be about 1.1 to 1.2, all right? That's a relative risk. What does that mean? Well, let me talk about rheumatoid arthritis. So rheumatoid arthritis occurs in 1% of the US population, okay, 1%. So your risk, any human's risk of getting rheumatoid arthritis is 1%. Just because you live in the United States, you have a 1% risk of getting rheumatoid arthritis, okay? And if you have a relative risk then of 1.1% so for instance, rheumatoid arthritis, remember I said if you get the vaccine, you have a relative risk of getting another, if you have an autoimmune illness already, as evidenced by your ANA, you have a relative risk of picking up another infection of about 1.1 to 1.2. So for instance, if rheumatoid arthritis occurs in 1% of the population, that means you now have a 1.1 relative risk of getting rheumatoid arthritis. What that means is you now have a 1.1% chance of picking up rheumatoid arthritis. Your risk increases by 10% with a relative risk of 1.1. It means your risk of getting that infection that occurs in 1% of the population increases by 10%, which increases to 1.1% relative risk. In other words, it's still extremely small that you're going to pick up another autoimmune illness, okay? And so I'm advising my patients to get the COVID vaccine because it is so darn harmful, okay? That's what I've been recommending, okay? I also will report that a lot of my colleagues that have Lyme, that are members of ILADS, those that have Lyme and are older that are starting to qualify already to get the vaccine, the reports we're getting from those people is that they are not having worsening of their Lyme symptoms by getting the vaccine either, okay? So I don't know what your provider is talking about here or what facts they're using to come up with that recommendation, but I disagree, all right? Good luck to you, Erica. Hello, Melissa. Do you have experience with patients' eyesight getting better when they take ivermectin? No, I don't. That doesn't mean it won't. I just don't have that experience. Nathan says hello. Hello, Nathan. Hello, Karen. Let's see. What is your preferred antibiotics for Bartonella? So I have a whole article about this. It's actually relatively new. In terms of Bartonella, we got to consider that there are two forms of the germ. So we know two states of the germ, I should say. So there's two growth states. There's growing germs, and then there are what we know as persisters. Persisters you can kind of think of as hibernating forms of the germ, okay? Persisters were just discovered about a year ago in a paper that was published in November, I believe, of 2019. It first showed us that Bartonella can have persisters, and that the standard antibiotics we'd been using to treat Bartonella were probably not useful on those persisters. Subsequently, we've looked to see, well, what can we use on those persisters? And the things that we can use that I like using are oregano oil and methylene blue. And there's been, where we're getting information about that is from research that's being done out of Johns Hopkins University by Dr. Ying Zhang. Dr. Zhang has been doing a lot of work on looking at what do we use for Lyme persisters and what do we use for Bartonella persisters. And these are all laboratory experiments, okay? All right, so to handle the persisters, I'm using either liposomal oregano oil, 75 milligrams twice a day, or a prescription medicine that has to be compounded called methylene blue, 50 milligrams twice a day, or I might use both. Okay. In addition, I like having people on at least 2 prescription antibiotics or 2 herbal antibiotics to treat the growing forms of Bartonella. According to Dr. Zhang's research that was published in April or May of 2020, the 2 antibiotic families that tend to be the best at growing Bartonella are the rifamycins, of which rifampin or rifabutin is one, or the macrolides, which is either azithromycin or clarithromycin. Those are the best 2 families. And so often I will start my treatment with a macrolide like azithromycin, along with a rifamycin like rifampin. I will also tell you, though, based on those experiments, that the tetracyclines are pretty close too, and also that using sulfa antibiotics sometimes can make a difference too. So at the beginning, when I first put somebody on a Bartonella treatment these days, where I start is I have them take azithromycin and rifampin. I also include at least oregano oil to treat for persisters, and that's generally where I start, okay? Let me show you my article on this so you can take a look at the research even if you want to, which I referenced there. All right, so take a look in terms of so if you're ever wondering what's some of the more recent things that I've written or published treatment. So for instance, ivermectin is something you can use to treat for acute COVID. I talk about the vaccine here, my opinions on that. And then I talk about a number of things, but one of the things I talk about here is, where's my Bartonella article? Here. So here's my article on Bartonella. And I think I updated this. I guess I updated it back in June. It's been a little bit of time, but it's still current in terms of the various things we can use. And I talk about the azithromycin. I talk about everything here. Okay. All right. So take a look at that. Good luck to you, Karen. Hello, Laura. P.S. As you predicted, the Botox shots seem to be helping a bit to reduce migraine pain due to Lyme and co-infection. Thanks for your help in the past. Laura, I'm glad to hear that. Again, I find it to be safe to do as well, too. So I'm glad. Thanks for reporting back here. I appreciate that. All right. Hello, Karen. Let's see. Hello, Dr. Ross. I've started Lyme treatment about 3 months ago with a great Lyme doctor here in Toronto. I have Lyme arthritis very badly in my knees and feet and can no longer walk at all. Do you think I can heal this crippling condition? Yeah, I do. I think it's going to take antibiotics. You're going to need to get inflammation down in the joints using the curcumin I mentioned earlier. And again, if over time you're just not getting much improvement, consider adding in the glucosamine sulfate that I mentioned earlier tonight too. But yeah, I do think you have good odds. Anyone with this kind of a setup, I think, has good odds. Okay. All right. Thanks for the question, Karen. Hello, Nathan. Let's see. Are mild hyperbaric units, soft wall, worth the investment? And that, do they force the oxygen deep enough into the tissues to have an effect on infections such as Lyme? All right. So hyperbaric oxygen, everyone, is a way of using high pressure to force oxygen deep into your tissues. Okay. The other effect of being in a hyperbaric chamber is that if you're on antibiotics, it forces the antibiotics deeper into your tissues as well, too. All right. Now, the other thing the hyperbaric oxygen can do is it's useful for improving, forcing oxygen deep into the tissues, forces that oxygen into your cell energy factories called mitochondria, and it can help improve energy function that way. And then finally, hyperbaric oxygen can remold nerves that are injured in your brain and plays with something called what we call brain plasticity, which allows your brain to develop new neurologic connections and heal. Now, so in terms of the three things that hyperbaric oxygen can do, it can potentially kill germs, it can remold the brain, and it can fix your mitochondria. All right. Of those, germ killing probably is not that useful. The reality is many of us used to use hyperbaric oxygen. There was a craze, as many of you know, there's a number of crazes we go through in the world of Lyme as we try to find things that are going to work for people. And probably would have been about 2007, I believe 2008, there was a phase where everyone was trying to do hyperbaric oxygen with their patients and using high pressure tanks, which are hard walled tanks that get up to 2.4 atmospheres of pressure. And what we soon started seeing is it really didn't make much difference in terms of the germs. It just didn't. So the oxygen, you would think, being forced under high pressure into the germs might kill them. It doesn't do that well. So I don't look at hyperbaric oxygen as a good germ killer. Okay. But I do think that it can help repair mitochondria, and I do think it can help repair neurologic injury. Now, what works best? The best would be a hard shell tank that goes to 2.4 atmospheres. But you can still get some benefit out of soft shell tanks. But the best benefit would be out of a hard shell tank. Okay. All right. Good luck to you, Nathan. I appreciate that question. Good luck to you. Hello, Kristen. Oops. Try that again. Hello, let's see. Hello, Kristen. In Dr. M and Dr. Breitschwart's protocols, I think you mean M is Dr. Mozignani, they say it's crucial to switch from rifampin to rifabutin at the end of treatment because of better tissue penetration. Why? What's the difference between the two? Do you agree with them? Is one better than the other if I tolerate both? I don't agree with them. I find both of these, rifabutin or rifampin, can be used interchangeably. So yeah, that's a nice opinion they have, but it's opinion. We don't have proof of that with any research. But in my experience, I don't see a difference. Thank you. Thank you for that question, Kristen. Hello, Jen. Let's see. Hello, Dr. Ross. I have 3 questions. Is it safe to take magnesium to address muscle twitching and fasciculations while on disulfiram? The answer is yes. When you retreat with disulfiram and use doxycycline and grapefruit seed extract, how long do you keep people on doxycycline? At what point do you initiate it? And if I'm going to retreat somebody with disulfiram, which treats persisters, and also put them on antibiotics like doxycycline or grapefruit seed extract to treat the growing forms of the Lyme germ, I will usually leave them on it the same period of time I have them on disulfiram, which is going to be up to about 8 months. Let's see. Have you considered long-term use of disulfiram for patients who do very well while on it but relapse when off? At this point, again, I'm not doing it as often. I find people are going to do great if you just get them on growing antibiotics for growing Lyme as well as being on the Disulfiram at the same time. It's something I could be open to, but I haven't had that option, or I haven't had that situation occur yet. I should put it that way. Let's see. Is muscle twitching a symptom associated with Bartonella, or can it be caused by Lyme? I more often associate it with Bartonella, but I have seen it occur with Lyme as well too. All right. That was pretty rapid fire there, Jen. Thank you for those questions. Anne, I see that you have a question that says Morgellons, but I don't see the rest of the question. All that I see is something that says Morgellons with a question mark. So I'm sorry, but I don't have something to answer here for that. Hello, Santiago. Again, let's see. Dr. Marty, ear ringing and head buzzing. Sound sensitivity is more prevalent in your experience in what Lyme infection? So the symptoms of ear ringing, head buzzing, sound sensitivities can be caused by both Lyme and Bartonella, but I find it more often occurs with Bartonella. All right. Thanks for that question. Hello, Seth. Hi, Dr. Ross. I've been very sick for a year with neurologic symptoms and doctors can't explain it. I found an old lab for anaplasmosis that showed my IGM was normal, but IgG was very high, indicating a past infection. My IgG is still rising. Would you treat for this? I also have had very low B12 of 171 and have been using injections to help. I don't know if this is related. So tick-borne infections do not cause low B12, but low B12 can lead to severe neurologic problems. And when you use B12 to correct neurologic problems, it can sometimes take a number of months for the resolution to occur. And even after you get normal B12 levels, sometimes that injury you got from having low B12 can be permanent, unfortunately. Okay, so I just want to point that out. So B12, there's a condition where some people are not able to absorb B12 in their diet well, and that's because they lack making a protein in the stomach called intrinsic factor. Intrinsic factor made in the stomach binds to B12, and then those two get absorbed together. And if you don't make enough intrinsic factor, then you're going to wind up having low B12, and you can get neurologic damage and injury from it, okay? But that is not due to any tick-borne illness, all right? Now, regarding anaplasmosis, so anaplasmosis is not something I would think of as giving neurologic problems. Typically, it gives more myalgia and fatigue issues, but not necessarily neurologic. But if you have positive anaplasmosis, that could indicate you were bit by a tick, and it could indicate that maybe that tick gave you other infections like Lyme and like Bartonella. Those two germs tend to have a lot of neurologic problems. So you might want to look at getting a high-quality Lyme and Bartonella test. The highest quality Lyme test you can get, in my opinion, is the newer immunoblot from IGenex, which looks to see if you have made antibodies against 8 strains of Lyme germs. It is much better than the standard Western blot that is done through regular labs, which only look to see if you have antibodies against 1 strain of the germ. The Lyme immunoblot through IGenex looks to see if you have antibodies against 8 kinds of Lyme, and it can find Lyme if you have it about 95% of the time, okay? In terms of Bartonella, the best test to check for Bartonella these days would, in my opinion, is to do the Western blot through IGenex that can look to see if you have Bartonella of the family that includes the 15 strains of Bartonella that can infect people. And if you are reactive on that, I would suggest testing for Bartonella as well too. Okay, that test can find Bartonella when it's there about 90% of the time. That's based on validation studies that were done by IGenex. Okay, all right. Good luck to you, Seth. All right. Let's see here. Boy, there's a lot more questions here. We are out of time. I'm sorry I wasn't able to get to everything tonight. There's some questions that I have here about alternative therapies, and I just want to do a quick screen share because there were about 2 or 3 that I saw that I'm just going to point an article out that you might want to look at. So there's a lot of people that are wondering about hyperthermia, about ozone, and about various other terms of alternative therapies. And I just want to show you a piece that I wrote called What Works? And this is based on research that was published by LymeDisease.org, where they queried people that had Lyme about what got them better and about their experience using alternative medicine, okay? And so I'm just going to point out the thing that tends to work best at getting somebody well is antibiotics for at least a year or more, not all these alternative therapies, not hyperthermia, not IV ozone, but antibiotics, and that can be herbal or prescription antibiotics, okay? All right, the other alternative therapies, if you're looking to see what is the chance that rifing might help me, or what is the chance that hyperbaric oxygen might help me, or what is the chance that I think ozone might help me, you can take a look at this table, again, that was developed by My Lyme Data and LymeDisease.org. And this is based upon real experience of people that went through it, okay? So stem cell therapy only helps about 3% of people, okay? Hyperbaric oxygen only helps about 22% of people. Rife machines, 35%. Ozone and oxygen therapies, 40%. I get some improvement on it, okay? But that's not getting well, okay? All right? Anyhow, take a look here. You're going to see a whole range of alternative therapies and whether they might give you benefit or not. Hyperthermia, 45%. One thing I'll say about hyperthermia is I think it gives temporary benefit. So everyone going to Clinic St. George, I think that the majority of people are wasting your money because most of those improvements you get are not sustainable, okay? All right, let's see here. All right, so I thought I would show that to you. There's a whole bunch of people that had questions I saw briefly regarding various alternative therapies, and I would just point that article out to you, okay? All right, so everyone, been great being with you here again tonight. If you like what we're doing here and like what I'm doing here, please share this. I want to try to reach as many people as possible with ways to improve their care. And so you are my word of mouth. And so I hope that you'll share this information either when you get the request to sign up for the next webinar, or if you want to share that email tomorrow morning, it comes out describing what we talked about tonight, including the links to the video. Anyone can look at that video after I get it published tomorrow. Okay. So I hope you'll look out tomorrow morning in your email. I will send out notification when I have the editing done. And then also you can use that same email to sign up for next week's webinar as well too. All right. Good night, everyone.